Know the facts about mental health. Be informed and help reduce the stigma. Half of all mental disorders begin by age 14, and 3/4 begin by the age of 24. Mental health disorders affect 1 in 5 people. A serious emotional disturbance affects 1 in 10. About 1 in 5 youth aged 13 to 18 experience a severe mental disorder at some point during their lifetime. That estimate is about 13% for children aged 8 to 15. Mood disorders, including major depression, dysthymic disorder, and bipolar disorder, are the third most common cause of hospitalization in the U.S. for both youth and adults aged 18 to 44. Over 1/3 of students with a mental health condition aged 14 to 21 and older who are served by special education drop out, the highest dropout rate of any disability group. 70% of youth and juvenile justice systems have at least one mental health condition, and at least 20% live with a serious mental illness. Suicide is the 10th leading cause of death in the United States, third for people aged 10 to 24, and the second leading cause of death for people aged 15 to 24. More than 90% of children who die by suicide have a mental health condition. Each day, an estimated 18 to 22 veterans die by suicide. Out of the 20.2 million adults in the U.S. who experienced a substance use disorder, 10.2 million of them had a co-occurring mental illness. Only 41% of adults in the U.S. with a mental health condition received mental health services in the past year. That number jumps to nearly 63% among adults with a serious mental illness. Despite effective treatment, there are long delays, sometimes decades, between the first appearance of symptoms and when people get help. Out of the 1 in 5 youth that live with a mental health condition, less than half receive treatment. Undiagnosed, untreated, or inadequately treated mental health conditions can affect a student's ability to learn, grow, and develop. Now that you know the facts, spread the word, create awareness, and help us reduce stigma.